Good day and welcome to the My Healthy Weight, a solution for payers to adjust obesity webinar. Today's webinar is being recorded. At this time, I'd like to turn the webinar over to Hannah Martin at the Bipartisan Policy Center. Please go ahead.
Thank you. Good afternoon or good morning to everyone, and thank you for joining us for this webinar. My name is Hannah Martin, and I'm a Senior Policy Analyst with the Bipartisan Policy Center's Prevention Initiative. For those of you who are not familiar with BPC, we are a nonprofit bipartisan think tank based in Washington, D.C. Our topic areas include health, energy, immigration, the economy, and more. Joining me today on the webinar are Jenny Bogard and Bruce Foraker. Jenny leads My Healthy Weight for BPC and has worked with us for many years, first as the Director of Healthcare Strategies at the Alliance for Healthier Generation, and now as a co-founder and managing partner of Commonality. And I'll let Jenny introduce Bruce a little later on. At the end of today's presentation, we will have ample time for Q&A. As was just mentioned, we will be using the chat box feature on your screen to collect questions. So if at any time during the presentation you think of a question, please go ahead and submit it there rather than waiting until the end. And just a reminder, you will not be able to ask questions using your microphone, so the chat box is going to be the option for submitting questions. And with that, I would like to pass it off to Jenny to walk us through the My Healthy Weight initiative.
Great. Thanks, Hannah, and good morning or good afternoon, everyone, and I hope everyone is staying warm and dry with all the weather out there in this country. But I'm thrilled today to talk to all of you about My Healthy Weight. It's an initiative that's near and dear to my heart and one that Hannah and I have worked on for many years, as well as with our My Healthy Weight founding members. So what is My Healthy Weight? So it is the first ever collective initiative that's providing obesity prevention and treatment to all individuals. And when I say the collective initiative, it really is a collective movement, if you will, including medical associations, government agencies, and payers, all coming together to align their benefit offerings to be consistent so that everybody has access to obesity prevention early treatment. So these are our My Healthy Weight founding members. As you can see, they come from a variety of organizations from all across the country. They have all signed the pledge and remain committed to addressing obesity within their own organizations. So why is My Healthy Weight needed? Well, I know everybody on this webinar today probably knows how much we spend on healthcare-related costs associated with obesity. But what I really want to talk to you about today are the ones that are highlighted in blue. I've been doing obesity research for many years, more than I want to admit, and I've worked with multiple payers and medical associations over the years. And one of the things that we have found in our research and our partnerships is the lack of consistent coverage is a significant barrier for healthcare providers and individuals accessing preventive programs. And to simplify this, if you have a physician who sees 30 patients a day, that physician has 30 different benefit design plans that they are working with. And what we know from the literature is that the default behavior for physicians is that they won't refer that patient out, or they won't schedule a follow-up visit because they don't know who has access to what. So what happens there is that many times we see patients who could benefit from additional counseling and support may go up to 1 to 3 years without seeing that primary care physician again. We also know that there's lack of referrals to allied healthcare professionals. Healthcare physicians or providers don't know who has access to what in terms of additional services. So we know that our registered dietitians and counseling and nutritionists out there that provide this extra support and counseling don't necessarily get referrals from physicians. We know that there's not effective communication, both internally at organizations, but also externally to both that individual, his or her family, as well as providers in network. So we know from the research in our multiple partnerships is that when a payer pilots a particular preventive service, an example of this is if you say, I'm going to offer a preventive service to 5 accounts on my book of business, You cannot effectively communicate that to all of your healthcare providers and networks, and you can't effectively communicate that internally with your claims department and also externally to those individuals. And the effect of that is denied claims. And we're seeing that as well when you don't have blanket coverage and consistent coverage to a certain preventive program. And then finally, the lack of awareness. Because you can't effectively communicate this, there's a lack of awareness both within a healthcare provider network. So all of your providers in your network may not necessarily know that they have access to these extra set of services, as well as that individual and their family. So all of these go together, and we're trying to address that through the My Healthy Weight initiative, because we believe that if we can create a tipping point where more people have access to a set of services than not, that we will see increased utilization, and the effect of that will be optimal weight management achievement. So who qualifies for My Healthy Weight? So the pledge is available online, but just to highlight the main points of the pledges, we worked long and hard with our task force members, and I'll give you a little bit of background in a couple minutes on how we got to where we are. But really, the pledge itself aligns, the required component is aligned with the USPSTF recommendations. And we know that technically payers are supposed to be compliant to any grade A or grade B recommendation. But through our work with payers over the course of several years, we recognize and acknowledge that not everybody is fully compliant to those recommendations throughout their entire book of business. So we decided to start there, and we wanted to get everybody on the same page. And then we also looked at a community component piece to it, where we looked at, we heard loud and clear from our task force members that they really thought that additional support happens and counseling can occur outside of that exam room visit. So they really wanted to see a community component piece as part of the pledge. And an example of this, and there's many, many different community interventions out there that are evidence-based, but one example, if you're wondering what would meet this requirement, is the diabetes prevention program. We know that Medicare covers it. We know that CMS recommends it. DPP is a program that we're seeing evidence-based, so we're seeing 5% weight loss and people that are going through the program successfully preventing diabetes. And that would be a community component piece that would meet that requirement. And then on this slide, as you see, we have some additional pledge components where we recognize that some of our payers are at multiple different points on the spectrum of offering preventative services and looking at how to kind of be ahead of the curve, if you will. So we wanted to include some additional components to really highlight what some of our payers are currently doing as real leaders in this space. So to give you a little bit of background of how we got to where we are, well, through the generosity of the Robert Wood Johnson Foundation, we launched a task force in October of 2016. And we invited payers from all across the country, and we broadly defined payers as Medicaid state plans, self-insured employer groups, as well as insurance companies. And we kicked it off with an in-person all-day meeting, and we went into the meeting with no agenda. We really wanted to hear from each payer the challenges, the opportunities, and what they feel their organization could contribute to this overall epidemic. And after that, we synthesized 20 pages of notes, and we did extensive follow-up with each individual task force member, whether it was virtual meetings, in-person meetings when possible, and follow-up individual calls. And we really wanted to continue to reflect back what we are hearing from the payers. And over the course of this relationship and continued dialogue that we were building with each individual task force member, we created this pledge. So this pledge really was a group effort and really reflects the conversations that we have had with each individual task force member. And from that, we launched the My Healthy Weight initiative last November at the BPC office in Washington, D.C. And we invited some of our payers to attend, and we had a panel where we listened to them about their commitment, and they talked about what they're planning to do. And we are all hoping and working towards being fully compliant for the January 1st, 2019 benefit plan year. And what's really interesting is from these conversations, and if you talk to our task force members, you'll hear from them is that the pledge itself is just the foundation. That's just the very beginning. What this pledge has been able to do for many of our payers is they were able to go internally back to their organizations and use this as a lever to have really honest conversations about what they were doing to address obesity. And they're able to look at their own gaps within their organizations, as well as identify opportunities of how they can strengthen their engagement with their members. Because the ultimate goal for a payer is really to have this continued engagement with each individual member. And how do we all try to achieve to get that optimal weight management goal, or reach that optimal weight management goal? So we are so excited to continue to grow this movement. I actually just came back from Nashville last night. I spoke at the Obesity Society Obesity Week and was so energized by all the wonderful people in the room when I was speaking and the employers that we were able to talk to. We just want to continue to grow this. Right now we have 10.5 million people across the country who will be under the My Healthy Weight initiative starting January 1. And really, if you're looking from a payer perspective, why would you join this initiative? Well, I can tell you, but I'm so thrilled to have Bruce on the phone because I really think that hearing from an actual payer why they're joining this initiative is so much more powerful than hearing it from myself. But just to give you a little bit of an idea of why an organization would sign on to this is, a lot of our payers have come to us and said, we didn't even know that there are resources out there. We were unaware of all of this. So we were able to tap into this world of resources that we didn't even know existed when we signed on to this pledge. And an example of that is we have payers that are continuing to talk amongst themselves around the challenges and opportunities. They're bouncing ideas off each other. Another example is there was one of our payers that had an internal analysis where they realized that they didn't have sufficient coverage with their RDs. That then started a conversation with the Academy of Nutrition and Dietetics, who then we all had an in-person meeting with the Academy as well as this payer, and we talked about how we can increase their coverage of RD and what the Academy can do to support their efforts in this. So there's so much organic stuff happening right now between payers, between associations. A lot of our payers have been invited to a lot of wonderful meetings in Washington, D.C. to kind of build out the research and talk to experts that are leading obesity work from an academic perspective. So there are so many resources at your fingertips when you join this initiative. The last thing I'll mention before I pass it over to Bruce, who's been my dear friend and colleague for almost 8 years now, and BlueCross BlueShield North Carolina is doing amazing things. They really are a gold standard from a payer perspective, and I give them so much kudos for their continued commitment to addressing obesity in this state. But the last thing I'll mention for our payers is that we are also creating a repository site for our members. So when you sign the pledge, you're going to have access to this website where we have collected evidence-based programs that meet these required components to the pledge that you may not have heard of as a payer. We hear things fresh off the press, if you will, from our researchers and our partnerships with organizations in DC, and we're going to be then sharing that with you immediately so that if you're looking for a particular program within a particular population, we're going to be able to connect you to those people so that you can start having those conversations about possibly implementing that program within your organization. So with that, I will pass it over again to my colleague, Bruce, so that he can share a little bit about all the amazing things that BlueCross BlueShield North Carolina is doing in the state.
Awesome. Thank you so much, Jenny. So as Jenny said, I'm Bruce Foraker. I'm Senior Program Manager at BlueCross BlueShield of North Carolina, and I'm going to talk a little bit about our nutrition counseling benefit and how we implemented it, and hopefully kind of build on a few of the concepts that Jenny presented earlier on. And just to start off, I'd like to apologize to everybody. I'm fighting off a cold, so if I sound funny, I apologize for that, but I'm going to do my best to hold everything together during the presentation. So let's see. Okay, so as Jenny said, BlueCross in North Carolina has been focusing on nutrition counseling and obesity coverage for a long time, and since 2005, actually, we started our nutrition counseling benefit, where we created our network of contracted registered dietitians across the state of North Carolina. And since then, we've been tweaking and growing that benefit. But originally it started out as a 6-visit limit on the benefit, where members were able to go to a dietitian 6 times maximum, and they also had to enroll in one of our disease management or wellness programs. And so we really used the program to tie into our existing disease management programs. For a lot of the reasons Jenny was talking about, over the years we have expanded that benefit. We see a lot of value and benefit to making the benefit easier for members to access and reducing barriers. And we find that by reducing those barriers, we really strengthen the overall program. And so today we do offer unlimited free nutrition counseling visits as our standard benefit. There's no BMI requirement, and there's no medical condition requirements to take advantage. So anyone that is interested in taking advantage of the benefit may do so, and that's almost universal throughout our entire commercial population with very few exceptions. This slide just really highlights exactly what Jenny was saying in her slides as well. North Carolina data is similar to what we're seeing nationally, where about 1/3 of members are being identified as being obese. And this particular study was based off of data from the Robert Wood Johnson Foundation. So we're definitely seeing in North Carolina similar trends over time that we're seeing across the country. So some of the barriers that we have related to our program, right off the bat, there were really big barriers to when we looked at how could we create a network of dietitians. Just credentialing the dietitians was a huge barrier. And one of the advantages that North Carolina had is that in North Carolina we actually license our dietitians. And that's not true in every state. I'm not sure how many states where dietitians are licensed or not, but in North Carolina they are, and that allowed us to credential and contract directly with our registered dietitians. However, even with that, it took a huge amount of executive leadership to make that happen. There was a lot of work that had to happen behind the scenes, and the various areas of the companies were already overworked, and so it really took a lot of vision and leadership within our executive team to break down barriers for us and get everyone pulling together to make the benefit a reality, and work with network management and our credentialing teams for the huge initiative of getting dietitians contracted and credentialed. In addition to our internal barriers, quite honestly, the dietitians themselves were a huge barrier, and I mean that in the most loving way. But they were they had never been a contracted provider with any insurance company before. They knew nothing about contracting. They knew nothing about credentialing. They knew nothing about submitting claims or really anything of the administrative functions of working with an insurance company. So meeting with the various professional societies and educating them and working closely with our resources within Blue Cross of North Carolina was extremely important in getting all of our dietitians on board so that we could have a good, positive working relationship. So today we have about 522 dietitians that are contracted all over North Carolina. That includes every single county in the state, and many of you probably realize North Carolina has a lot of very rural counties. And so that was quite an accomplishment from my perspective, just to make sure that we had geographic coverage across the entire state was a huge barrier initially, and one that we worked really hard on to recruit and promote the programs to dietitians within the smaller counties within the state. Another piece to this is that I can't underestimate the importance of this fact that our dietitians are such a strong part of our health management initiatives within North Carolina. They're really an integral piece of all of our wellness and disease management programs. There's a lot of cross referrals between our disease management to our dietitians, and our dietitians back to our health and wellness program. So we work very closely. They are truly a trusted partner. They are an extension of our programs. They reach out directly to our members, and having that face-to-face contact with our members has been extremely valuable for us. So we have found that piece has been an extremely important part of our overall initiatives. So obviously we couldn't talk about designing a whole new provider type without talking about the impact on costs. And obviously that was a huge barrier right up front when we designed the benefit, and we're working with our leadership. And it wasn't just the leadership of Blue Cross of North Carolina. Once we started talking to our large ASO employer groups about it, they also expressed a lot of concerns about creating a whole new provider type, how much utilization we would potentially see, how much value would their employees get from the program. At the time, we didn't have a lot of strong evidence one way or another. We had a belief that we felt like this was the right thing to do, but we didn't have strong, solid evidence to point to say, yes, we think we can reduce costs for you by this amount. So a lot of it was, quite honestly, really on our chief medical officer, who really took a leap of faith, got our leadership, our executive leadership team on board, and they worked with our sales teams and our sales executives to get our employer groups on board as well. And so there was huge amounts of, just leadership saying, this is going to be something that is going to be of value to your employees, and it was a real sales challenge to get our employer groups on board. But what I'll say is that they did such a tremendous job that we had very few of our large ASO groups that wanted to not participate in this program. So almost everyone tried the benefit the first couple of years that we offered it, and that definitely reduced a lot of the challenges that Jenny was talking about, because it was such a broad-based benefit even from the beginning of the program. After the program was implemented, we did do several different studies that were published. The first one was done in 2008, and quite honestly, the irony with that is that even though that study was published in 2008, we finally were able to show we had definitive results showing cost savings to our employer groups. By that point, our employer groups loved the program so much, and they had integrated the program into all aspects of their health and wellness, and they were making sure that dietitians were available on site for their employees, and they were hearing such great feedback from their employees that they loved the program. They were not as focused on our outcomes data as we thought they would be. So sure, they were happy that we were able to show cost savings, but they really loved the program almost from day one when they started seeing the real-time results that the program was able to deliver. We then did show two more studies that we published in 2011 and 2013 demonstrating improvements in clinical outcomes such as reductions in weight, improvements in blood pressure, waist circumference, those type of things were done in those two studies. And I do have links to those in the appendix for you as well. So taking a look, so another huge barrier to the program, just like Jenny was talking about, physician barriers to this day are very strong. It's hard to get physicians to know that this is a benefit to their patients. So we really struggle with this one, and we continue to work with our physician programs, our physician partners on this to really demonstrate that the benefit is available to their patients and how they can take advantage of it. But another aspect of this has been our employers, and as I mentioned, our employers have been extremely supportive of it, and it really has strengthened the bond between a lot of our employer groups in Blue Cross in North Carolina, because it's such a strong outreach initiative that we're able to provide to their employees. Another really big barrier is out of state. So this is a very in-state North Carolina benefit. We do have a lot of employers that have membership that lives in multiple states, so we continue to work on that. I think there's a lot of really good options moving forward from a telemedicine perspective and some other contracting opportunities that we will eventually implement to help with this specific issue. But out of state is still a barrier that we have for our membership. So just real quickly, some of our key takeaways. I'm sure that you've heard me say it, but I can't stress it enough. If you're going to launch a benefit similar to this, it's really going to take strong leadership within your organization. The amount of reliance that we had on our leaders was huge, so having strong leadership is just imperative in order to get this off the ground. Another key issue that I guess I want you to hear as well is that people were scared to death when we launched this about overutilization and what would happen and what controls would be in place. Overutilization has not been a problem with this program. So we definitely monitor that very closely. Since the program launched, we've only had one dietitian that has been decredentialed out of the network due to overutilization issues. Our dietitians are very close partners with us. They love that we offer this benefit, and they work with us so closely. It really is a partnership like we have in no other section of our business. So it's really just a strong partnership, and we don't see any issues with overutilization. Which brings us to the next point. And again, I think this fits very well with what Jenny was saying, that we feel like the benefit works better by making it more broad versus too specific. So reducing the barriers for people joining the program, I think, is a way to make the program work better. I think it also is a way to improve your data and your analytics when you're looking at broader populations versus smaller populations. To address some of the out-of-state barriers that we talked about, we're definitely looking at some telehealth initiatives as well as maybe some contracting solutions that might help us with those barriers. And then lastly on here, creating a network of dietitians is really hard. It's going to take twice as much work as you think it's going to take. And what I'll say about that is I feel like it's 100% worth it because of having that strong community outreach where you can get that face-to-face interaction with a help of a provider that not only cares about the patient that they're seeing, but they care about Blue Cross of North Carolina. They support our programs, and they're really just a huge advocate for everything we do. They help patients understand why they might want to join a disease management program, even if they like their physician, and things like that. It really is just a strong component of what we're able to achieve from a health management perspective. The last item that I wanted to touch on real quick was just Jenny mentioned the community outreach and the pre-diabetes. And I was hoping to have a big announcement for you guys today, but we don't have signed contracts. But what I do want to let you know, and as soon as I have something ready to go, I'm going to let Jenny know, and she'll I'm sure, communicate it out to the entire group. But Blue Cross is going to be announcing a pre-diabetes community initiative here in the next few weeks, and I'm so excited about it. I think it's going to blow your socks off. I think you guys are going to love it. I think it's going to be really valuable when you're talking about the ability to analyze the effectiveness of pre-diabetes programs into the future. I think it's going to be valuable for our policy decisions as well as local government, state, and federal government, and other health plans will really find a lot of value in that program as well. So I definitely think that's going to be something for you all to watch for in the near future, because it's going to be super exciting. So I'll leave you with that level of anticipation.
Great.
And then
Thank
the last
you so
slide
much.
there is just the program studies that we have.
Thank you so much, Bruce, and thank you to Jenny as well. So if you all have any questions, please make sure to submit them through the chat box, and I'll make sure they get asked to our presenters. We do already have one question. Bruce, this one is to you. Someone writes that in their state they're having trouble getting their BlueCross BlueShield to recognize registered dietitians and medical nutrition therapy, and that the reimbursement rate is very low, substantially lower than what Medicare is giving. And they're just wondering if you have any recommendations on how to improve this and how to work with that Blues plan.
Yeah, so that I'm not sure which state that is, but what I'll say is that we for the most part pay a percentage above Medicare reimbursement for nutrition counseling therapy. So that's how we do our fee schedule. And I'll say that, again, from our experience, we see so many positive impacts from offering that and expanding it that I would encourage that plan and would be happy to, if they were interested in learning more about what we've been able to achieve and do, I'd be happy to discuss that with them.
Great.
So give them my name, I guess.
Yes, I'll work to connect the two of you offline then after the webinar. Jenny, a question for you. In addition to what support that the My Healthy Weight signatories are receiving after they sign the pledge, could you speak to some of the support that's available if, say, someone in a company is interested in getting their company to sign on but needs to work their way through the approval chain, and the help you've been able to offer people in those circumstances?
Yeah, that's a great question, Hannah. You know, what we do as a project support team is we're here for you. We recognize that there's many different cooks in the kitchen at big organizations and that everybody has to be on the same page and working with multiple different departments down to the actuaries, to marketing. We are here for you. If you want to take this information and this program to your organization, having those initial conversations and connecting us, we're happy to have additional conversations. I've done follow-up webinars where we brought in 20 to 30 people at a specific organization to kind of walk everybody through the program so that everybody can ask me questions directly rather than going through their contacts at their organization. So we're here really whatever you need from us. We can do conference calls, in-person meetings if possible, webinars. We can send you information. We can connect you to other My Healthy Weight members. Our members have been so gracious in offering their time to talk to other companies who may have questions before they sign the pledge. So really it's a wide range of support that we can provide to you as you take this internally to your organizations.
Great, thank you. I just switched back to that resources slide. Someone was requesting that. I did want to remind everyone or let you know that we will be sending these slides. It'll come in the form of a recording, so you'll get a recording of the webinar, which will include being able to scroll back and forth and see all of these slides. So that should be available probably sometime next week. And you will all get that. And if you have any colleagues who RSVP'd for the webinar but were unable to join us today, I will be sending the recording out to them as well. So let me just look really quickly through our questions here and see what else we have coming in. I did have a question. Someone had a question about M&T codes. Bruce, is that something you know off the top of your head, which ones you're using, or no?
Yes. So we have it's probably like 5 different HCPCS codes that we include in the dietitian fee schedule. And one of them is we actually include the G codes that are related to the diabetes education programs as well. I think it's the G0108 and the G0109. We allow for the codes that have both one-on-one or face-to-face counseling as well as group counseling codes are available. And I can definitely include the list of the specific codes that we use, but we actually use the HCPCS codes are the ones that we're using for the program. So I'll send that over to Hannah.
Yes, and I will get it to the person who was asking. Just a reminder, make sure you submit any questions. We will let you go once we've answered them all. So if you have anything on the tip of your tongue, please get it in. So Jenny, I think probably this question would be best for you. Someone says that they are in Texas, where Aetna, who is one of our other signatories, Texas Health Aetna is, and they are wondering how they should be ready to interface with them once this benefit goes live. And they didn't say, but I'm wondering if this person is potentially also an RD or another provider type. And what are your recommendations for that?
Yeah, so Texas Health Aetna is working towards being compliant on January 1st. So I think as a provider, whether we can maybe connect you to our contact there, and you can see about any information that they're going to be sending out or materials regarding this. I'm not really sure what they're doing in terms of communicating to the healthcare providers at this point, but I'm happy to connect you offline to our contact there, if that's helpful.
Great. And as I think Jenny mentioned before, we do anticipate, we have requested via the pledge that all of our signatories proactively reach out to their in-network providers and their beneficiaries, but that would all occur after the pledge takes effect. So hopefully that information will be coming out from Aetna and our other signatories early next year, or at least sometime in the first year. Oh yes, this person confirmed that they were indeed an RD. So I will make sure that any of you who have these more technical questions, I'll make sure that you are put in touch with Jenny and Bruce to answer those.
And Hannah, I'll just say, we also partner with the Academy of Nutrition Dietetics, and one of my colleagues there oversees all of the coverage and reimbursement, and she's a fantastic resource. So I can also connect this person to her, and she can help you navigate through the system in Texas.
Wonderful. Bruce, a more general question for you. If there was somebody at another Blue Cross Blue Shield, one of your sister plans, that was interested in this, would you be willing to help them and talk through your experience more one-on-one with them?
Yes, absolutely. So I've done that with several Blue Cross plans already, and happy to talk to anybody, as I can kind of go on and on. So definitely, if they're willing to take some time, I'm happy to share all of our experiences.
And Jenny, is it fair to say that that's a sentiment that a lot of our current signatories share, that they're excited to get others on board and have been pretty generous with their time?
Absolutely. I mean, I think going back to what I said earlier, and our members get this more than anybody else, is that you really do have to have collective movement here and action when it comes to successfully implementing preventive programs. So from their perspective, if they're putting this investment up front, they'd like to see other payers within their states, within their areas, that are also offering the same program. So everybody has a vested interest in scaling this to achieve that tipping point. So they are more than eager and willing to talk to other payers looking at adopting this initiative.
All right, last call for any final questions. I'll give it another 15 to 30 seconds just to see if anyone has any last thing they've been holding on to. All right, well, not seeing any additional questions coming in. Bruce, Jenny, would either of you like to provide any closing remarks before we sign off?
Just that I'm here and available to talk to anybody, to help organizations navigate this internally, to have meetings with other organizations. Again, I can't emphasize this enough that we want everybody to have access to the same set of services, and we want healthcare providers to get reimbursed for their time. So this is a win-win situation for everybody involved, and we recognize that there's multiple different stakeholders that have to be engaged to make this a success. So thank you for your time. Thank you, Bruce, again, for all of your time as well as your commitment to obesity prevention. And if anybody has questions, you know how to get a hold of me, and I'm happy to have follow-up conversations with anybody.
Bruce, any last words of wisdom?
Yeah, so just to echo what Jenny was saying, I would say that I do feel very strongly that, especially when we're talking about the physician side and promoting the programs, getting that critical mass is really important, where it's more of the rule than the exception of the rule for coverage for nutrition counseling services. And so I definitely hope that others follow suit and offer this. I think it's a great benefit. I think it's just adds so much value for our members that I can't speak enough about it. So please think about participating.
Hear, hear. Second that. Well, thank you all for joining us. Thank you again, Jenny and Bruce, for these great presentations. We will be posting a recording of these of the slides in the webinar on our website early next week, and I'll be sending that out over email to you all as well. In the meantime, if you want any more information, please visit myhealthyweight.org. And I hope you all have a great rest of your morning or afternoon.